Welcome to BPS Live. This is Steve Ronan, and today we're going to talk about hair restoration. We're going to talk about all types of facets about it, medical, surgical, everything in between. As usual, I have my guest host here, Brett.
Hi, Dr. Ronan. Good to see you. I'm excited to be here today. I'm going to be manning the chat at the end of the show to make sure you guys stick around. This will be exciting.
Awesome. So if you have questions at any time, put them in the chat. Brett's going to collect them, and at the end, we can review all of those questions. And so we're going to go ahead and bring in our first guest today, and that's Adriene, who is a nurse who has extensive experience in hair transplant. So she's the Hair Transplant Director here, and she comes all the way from Italy. So when I speak with her, I'll speak slow because this is her second language. Is that right, Adriene?
Sort of, yes.
Yeah. She was born in Italy, and so and she comes all the way there, but she grew up in Philadelphia, and we're lucky to have her here. She's like super experienced and does a fantastic job for us. So Adriene, let's talk a little bit about what we do when we bring someone in for a consult. So when you want to talk a little bit about that, how we get started?
Sure. So all of our consults can be either virtual or in office. Virtual, usually the approach is we give general information, and then if we want to proceed, the patients usually come in to the office. In that way, we do a thorough analysis of the scalp with our dermoscopy, and we can really evaluate and do the proper diagnosis and see if they're a candidate for hair transplant, medical treatments, whatever we decide. And that's usually how.
So it's kind of important to do a dermoscopy, and we do that on virtually all of our patients before we do a transplant or even before we suggest medical treatment. And what a dermoscopy is, it's sort of a camera that we could put right onto the scalp. It gives very close-up images. We can actually see down into the scalp, and it lets us evaluate any kind of medical problems that might be contributing to the hair loss. So most of the time, it's just the routine hair loss that we see, and we can proceed with the surgery or medical treatment. But sometimes we'll see some inflammation or autoimmune problem that we want to treat first, or might even prohibit doing a transplant. So it's really important to get the right diagnosis, because if you were to do a transplant in the face of autoimmune disease, it wouldn't really work. So we want to make sure we do everything appropriately, which is why our consult's pretty thorough. Yeah.
Yes.
And so at that time, you'll also have some pictures done, and we can review before and afters. And so we can actually, what we're going to do today is we're going to intersperse some before and afters during our discussion. So we can go ahead and show our first one. And so this is a female patient who had about 3,080 grafts. And so we'll come back to the surgery, but a lot of times female patients are fantastic and respond very well to medical hair treatments, even more so than men. You want to give a little talk about how we approach medical?
Yes. So if we evaluate and Dr. Ronan decides that we're more directed towards medical treatments, we have a special protocol that we have here called the Hair Max, where it is a combination of PRP, platelet-rich plasma, and microneedling of medications that go directly to the scalp and treat the actual cause of hair loss. And we've seen great results with that. We've seen that it takes a while just to address each hair cycle. So we address that in over a period of time of 6 months, and usually we start seeing those results, and we actually can slow down the hair loss process, and often we use it in our post-op after surgery as well.
Yep. So you can think of it as if the hair follicle is there, but it's not growing that well. It's just kind of a little bit weaker or slower. We might be able to perk it up with some medical treatments and or prevent the loss. And so that's what we try to do. Now, a hair cycle lasts about 3 to 5 years. So you start a new hair. It grows for 3 to 5 years, and then your body holds on to it for a while, and then it lets go, rests, and starts a new cycle. How long that cycle is will determine how long your hair can grow. So some people can grow it, very long, and some not so long. But the point is that a 3 to 5 year cycle is a long time. And so you can't expect sort of a one and done with medical treatments. You have to support the hair through a significant part of that cycle to get it to come back on and grow well. And so if you're going to do some sort of a medical therapy, most of the time it's going to be 6 months or a year or more. And over that period of time, we hope to see improved growth. So it's kind of little things we do when we're doing medical treatment. So we also do some oral, topical things.
Oral, topical. It's a combination of different things that we need to address, and that really slows down the hair loss.
So,
because our goal is, yes, to restore, but also slow down future hair loss.
One of the things we'll use is, what maybe our most common is probably oral minoxidil.
Yes.
Minoxidil is a blood pressure medicine at much higher doses as a blood pressure medicine. And family practice doctors noticed when this came out that people were growing a lot of hair. And so that's where Rogaine topical came from. But if you take a little tiny dose of minoxidil orally, it's really pretty fantastic for hair. So that's one of our more common also medical treatments. Well, we go ahead and go on to our next set of before afters, which is another female. You want to talk about her procedure a little bit?
Yeah, so with her, we did the hybrid approach, which is basically the mix of the two procedures, the FUT and FUE. This case was 3,024 grafts to be precise, and that is a 1-year follow-up for this patient. Her main concern was the frontal hairline, and we designed it together, and she's very excited of her results.
You mentioned FUE and FUT, and those are two of the more common methods used to obtain the grafts to then transplant. So the older method is the strip, or FUT strip. It's what we typically call it, or we take a strip of hair out of the back of the head, and then that strip is chopped into all the different grafts, and very tiny grafts. And that, I usually take off and close in about 15 minutes. So it's pretty fast to remove that strip. It does leave a linear scar across the back of the head, as opposed to an FUE treatment where we have a tiny punch that's less than a millimeter that we remove the grafts individually, one at a time. And that is done across the entire back of the head. And so in order to do an FUE, you have to shave a larger section of the scalp. And so if you have short hair, and it's really easy to shave a lot. If you have long hair, you're going to be very reluctant to shave like the entire back of your head.
Yeah, and this method has allowed us really to get a lot higher number of grafts, especially in our female patients.
Exactly. So with the females, since they have long hair and you're not going to see the scar, we oftentimes take a strip, which allows us to get a bunch of grafts, but then we can shave a small area around that and take FUE, and that is where we get really a large number of grafts without her having to worry about camouflage, because it really hides very well. A typical transplant procedure might be anywhere from 2,500 to 3,500 grafts would be maybe our average. Strips usually yield a little bit less than that, but when you do a strip with a little bit of FUE, or the hybrid as we call it, then we can kind of get those high numbers. That higher number.
And to get the density that most women want in the frontal hairline, we really have to aim for those high numbers, because the higher we can go, the more density we can create. So I think that method for us is working really well.
We're going to come back. We're going to talk about recovery later, but really when we do that and they have longer hair, a week later, even it's pretty tough to tell that they had anything done. So it hides extremely well for women. Men, it takes a little bit longer, before you can't tell we did anything. Let's go ahead and look at our next female patient. And so she had 2,922 grafts, again, another hybrid. So if you want to take a look, you can see her temporal area there. She had a fair amount of loss, and then all the way across the front was getting a little bit light. And so we brought her hairline down and added a bunch of grafts. And one of the things that we try to do is make the hairline very jagged. And so it's sort of moving back and forth and not a straight line. And we think when we do that, we can achieve a much more natural result. What do you think? Like, when you compare pattern of how we graft in for females compared to men, what do female patients want?
Female patients typically want the high density, the natural look. So that's why we're creating those irregularities in the hairline, putting very small grafts in the very frontal. So one hair grafts definitely in the immediate frontal hairline. And women have that heart-shaped hairline as opposed to men, where we create the temporal peaks, and that's the main difference. But for sure, the main concern for women is definitely high density.
Yep. The female patients, they're a little different than the male patients. A lot of the guys come in and they're like, yeah, it's not that big a deal, but I get it wet. I look in the mirror. I don't really like what I see. Why not? Why not have more hair? And then, for professional reasons, work reasons. But a lot of times the females are a little different, and why they want to do it and how it's impacting them.
It impacts their lives a lot. It really affects their self-esteem. It affects their daily living even. And a lot don't know that this can be a possibility. Now, our challenge is making sure that they are true candidates for a hair transplant, as opposed to just doing, and that's why our dermoscopy and our thorough consultation is so important. And once we determine that, and they can actually have restoration, that they're just so extremely happy, because they didn't even think that was possible, and they probably tried so many things prior to that, which may have been just vitamins and other things that are not really treating and medically approaching.
So that's totally true. Just about every woman knows if they're flat, they can get a breast augmentation and problem solved, right? Female hair loss is super common, affects so many people, but typically hair transplants are thought of something that guys do, because guys go bald, right? And so the women sort of don't realize they can do this, might think they have to shave their head. It's kind of an uphill struggle, and really we can do it in a way that isn't so bad with the hybrid, and it can really have a profound impact. Yeah. I guess one difference would be that with longer hair, as it's going to take a long time to grow out long, but you get the density really, much faster.
Yes. Yep.
So good. Well, let's take another look at another picture, which is a male patient. And so this gentleman had just over 3,000 grafts in one session and had a very nice result. You can see sort of on the center part of his forehead, he kind of lost hair, almost like a triangular pattern going up, and we're able to fill that in and keep the hairline looking very natural, and just gave him a lot of density, sort of like a 5A going on 6 is a classification, which means really the entire top of the head going to the crown is suffering from some of the loss. And so I think he had really, a pretty good result. One of the things we can talk about is what he would go through on, a standard day, right? It's a big production. It's going to be 10, 12 hours. It's going to be 4 of us, typically 4 of us, doing this. It's definitely a team effort. If you think about it, we have to prep, we have to remove, say, 3,000 grafts. We have to treat all of them, make 3,000 holes, and then put each one of them in, really. It's a lot of
It's
labor.
a long day. It's a long day. Our patients, usually we start very early in the day. We do the design of the hairline, take pictures, and then we start the hot process of numbing the patient and just starting the harvesting part. Harvesting can take, depending on the number of grafts that we're going for, but I would say 4 to 5 hours.
Yep, depending.
And depending, it could be somewhere around there. And we do take a break for lunch, which is nice for the patients. Yep. That's the best part of the day for them. And then the afternoon is really all for implantation. I think the beauty of our practice is we actually do it in an OR, very safe environment. We have a set team of technicians who play a huge role in this because they are the ones who are checking each and every graft. We sort each and every graft. And before placing those grafts, there's an actual briefing because each hair grouping, our hair grows in groupings. So we actually separate the 1 hair grafts, the 2 hair grafts, the 3 hair grafts. So then when we're creating our densities that you and I brief before implanting, that's where we create those results where they look natural. We're not putting larger grafts in the front. And it's extremely important to go through these protocols that we have set in place to then get the best result at the end. So it's a long, boring day for them, but
it's a long day. And so when it comes to the harvest part, and this is kind of important, we have multiple different technologies. So we have the robot, we have a neograph, we have manual FUE, and we can do strip, or we can do a combination of those things. And why this is important is we tailor it to the needs of the patient. There are times that we start with one technology and then quickly figure out that scalp is too fibrous or for whatever reason not harvesting well with one technology. And so we'll just lateral over to another one. And so because we have, at least four different ways to remove grafts, we can always pick the one that's going to be the best result for that particular patient. We're sort of agnostic to which one it is. We just want to find the best one for that particular scalp.
Bring us the best grafts.
Right.
Because that's the important.
Wherever we can get the best grafts. And it's definitely happened before where we will, maybe be doing the robot and switch to, to a more manual FUE or, vice versa, depending on that particular patient's scalp. And so we'll usually have a plan ahead of time of how we're going to do it. And most of the time it goes according to plan. But occasionally we'll audible and move over to something else.
But the beauty is we have all the tools necessary. So we're not obligated to use one set tool that may not give us the best grafts. And that's right. Another thing that's extremely important.
Yep. Super, super important. You can, so part of the processing of the grafts by the technicians and the team is they're actually under microscopes, and every single graft is looked at under the microscope, cleaned, and sort of set up, counted, placed in those piles. And she mentioned 1, 2, 3 graft piles. When we're on the perimeter, we'll do single grafts so that it looks perfectly natural. We don't want a bunch of hairs coming out of one tiny spot because that might catch your eye on a hairline. So we'll make all single grafts. But as we go further back, we want to get more bang for the buck. So we can get 3 hairs for 1 graft instead of 1. And so as we get more central or, away from the hairline, we'll put those, little slightly bigger grafts in.
Yeah.
And that way you can get more volume. So how many years have you been doing hair?
Over 30.
Over 30.
Yes.
Which is, so at some point way back when I was a resident, the technology wasn't here yet. And I didn't think the results were all that good. And I remember saying to my friends, over my dead body, will I ever do a hair transplant? And then the technology developed and it got better and better. And now it's like something I love to do. It's invisible. The results are fantastic. The patients love it. It's actually become more of a passion now.
Yeah.
Where long ago I really didn't want much to do with it. So I'm sort of eating my words on that one. So let's go ahead and look at our next gentleman who also had about 3,000 grafts. And so you can see he's
one of our younger patients.
A bit of a younger guy, right? And so there's some discussion that needs to happen with younger people as to when we should transplant them, whether we should transplant them, because if someone's young and you do a transplant and then they lose a bunch of hair behind it or wherever, you could end up with sort of a funny pattern. And so the younger the patient, the more we need to think about, we're going to put these grafts in such a way that if this patient keeps losing hair, that they'll still look good, like it'll still look normal. And so when you approach it that way, you can do someone who's younger. What you wouldn't want to do is a young person starts losing a little bit, and they start losing their crown, not so much in the front, and then you take a whole bunch of grafts and put them in the back, and then you're kind of in trouble later when they lose hair. So we're very careful on young people. But as you can see, the war has been fought and is mostly over, right? And so the whole top, this is what we would call like a 5A. Most of the top of the head is, the war has been lost, right? And there's not that much hair left. And so this isn't going to change that much over time. And so we feel comfortable, putting grafts into these areas and can really achieve, a great result.
And the younger patients are a lot happier because they can live their youthful life with hair.
Right.
And of course, we'll address future hair loss, but the fact that they can live their youthful life with hair is they're extremely happy.
Yeah. So it's fantastic. So
yeah,
let's go over, once you finish this long day, you're here for 10, 12 hours, you can drive yourself home. But what's the recovery like?
So I would say that the social recovery is about a week, meaning we have a protocol with all the washing instructions, and there's a lot of washing involved. But once you get to day 7, your washing becomes a little bit more normal. And I've had patients, after a week, just go back to their normal life. Like, no, you can wear a hat as of day 2. The only real downtime is your physical activity. So no exercising, no heavy lifting for that week. And once we see you after those 7-10 days, we give you the green light and you literally go back to doing what you were doing before.
Yeah.
So it's pretty easy. I know there's a lot of scary stories, and some patients come in thinking that it's a big recovery, but at the end of the day, like I said, it's really that week. So
yeah, most of the time it's just Tylenol, Motrin for most patients.
And they feel fine, and many who work from home, they work the next day.
Yeah,
literally.
You can go to work in an office type situation the next day, no problem, or work from home, no problem. Let's talk a little bit about we talked a little bit about female hairlines, and one of the things you mentioned was the temporal part for men. And so one of the things that we want to do for men is leave a little bit of temporal recession. We don't want to make them like a teenage hairline, because it just,
it's age appropriate.
So it's age appropriate. So we'll make it with a little bit of recession, but maybe talk a little bit about our strategies with our male hair transplants.
So I always say, and I mean, we always talk about it and say it's a true artistry on how we're going to give that illusion of coverage with the amount of grafts that we have. We always go by the prioritizing what the patient wants, obviously, but it's really about giving that illusion of coverage with the amount of grafts. Because if we have, let's say, even it seems like a high number, 3,000 grafts, but if I do 3,000 grafts from front to back, it's going to look different than if I do 3,000 grafts from here to here.
Right.
But if we want to address the whole area, we are really briefing on how to distribute those grafts, so we give an illusion of coverage throughout the whole head, basically.
And and sometimes if there's enough hair loss, it might take more than one procedure. And so we kind of find that the most valuable graft is in front, and the least valuable in the back on a gradient. And a lot of patients will come in pointing to their crown, but really the front is more important. Most of your life, you're going to be seen from the front and not so much from the crown. And so we get to the crown, but we always want to make sure the front is pretty solid.
And that's important, because if we were to do all the hairs in the back, then all of a sudden the front would be more visible and would stand out.
And you're
more.
kind of in trouble.
And then you're in trouble, yeah.
So there's other things to consider, not just the distribution of wear, but really the angulation of the hair, right? So that's one of the things that we think about. They originally, way back when I was a resident, I'm like, I'm not doing this. A lot of the hairs went in at 90 degrees, right? And they just kind of came straight out, which really looked a little bit silly. But if you look at a head, the hair kind of comes around like this, right? Comes over the top and then goes this way. So there's definitely a directionality. And then in the back, there's, oftentimes a whirl. And so in order to keep the hair looking natural, we need to follow that directionality. So the recipient sites that we make will be made at an angle. So the graft will go in at the appropriate angle and come out directionally in the right direction.
And then we also evaluate, often we do the temporal peaks, because we're not only seeing from the front, but we're also seeing from the side. And so we try and match the side to the top that we're creating. So it's really an art to.
And then sometimes their temporal area will go back this way, and we'll need to bring that forward to meet the hairline, because otherwise the hairline comes way back here, and that like triangle, which I find a lot of places leave, it's like kind of a real big giveaway as to that you had a hair transplant. So we sort of need to bring that temporal area forward a little bit. Okay, let's talk about our next picture. This gentleman had about 4,000 grafts, and in one session had a fantastic result in one day, and grew a lot of hair. So kind of kept, we didn't advance the hairline too much. The more you push it down, the more grafts you need, right? So if you're trying to create a forest in a desert, you want to be very careful about how far you go, because it'll consume a lot of grafts to, bring it down. And so we can really get some nice density. Let's talk a little bit about patients that might want a second or a redo or revisional type of, hair restoration. There are lots of patients whose hair loss is significant enough that we can't do everything at one time. And so a lot of times we can make a lot of progress, but they'll maybe want to come back and follow up with some more grafts. When do we usually want to do that, and who wants to do that?
Usually the soonest we can do it, if it's a patient that we do and then they want more grafts, which happens, the soonest we could do it is a year after. But it really just depends. That's why we're really strong on our medical treatments and post-surgery. We want to try and hold on to the existing hair, as much as possible. So we could really do it anytime after that year. But if like the patient we saw last week who'd done it 30 years ago when we had, and back then they were using plugs, and he did the strip, and now we're able to correct that and give him more hair with the new technology that we have.
So we're able to do, really it's an interesting combination. So he has a strip, and then he has a whole bunch of scars around the size of an eraser head, sort of in rows across the back, which were the old plugs that would be 30, 40 hairs at a time. And so those just healed as big scars. And so what we did, but above that, he had really nice hair, like really good hair for transplantation. And so what we're going to do is repeat. He has good elasticity, so we're going to repeat a strip, but we're really going to be excising all that scarred area. and collapsing it down. There won't be a ton of grafts in there, but there'll be a good amount of grafts. But now at least you'll have a line instead of all those sort of pencil eraser scars. And then above that, we'll do FUE, harvest a bunch more grafts, and
Probably,
I think he'll
good number.
Yeah, and I think we can then put those in and around the plugs and sort of make them just disappear, as the new hair grows.
So I think with the technology and what we do, we can, for patients who want to come back, or some patients who had plugs, and if we go in with all those micrografts, all of a sudden it'll look natural again.
Exactly.
So and that's huge too.
Exactly.
Yeah.
Well, we do have a special guest, and so I'd like to bring him on in here. This is Scott, who about 6 months ago had a hair transplant. And so I guess my first question, Scott, is like, of all the many things that you wanted to do, what made you choose the hair transplant first?
Sure. So couple things. One is I'm in public. I do a lot of public speaking. I'm with younger people. My hobby is I coach high school football. And instead of being the older, out of shape guy that is only looking worse every single day, that the hair loss was, contributing to that. Yep. And I thought that was kind of the first place to start. Obviously, exercise and the other elements around my physique. However, I said, hey, I feel more confident. I feel better about myself. I felt better in the professional world and then just personally.
So you're about 6 months out. What was the recovery like? You were here all day.
Yeah, it was fairly insignificant is what I would call. I was here all day. So that whole day was a downtime in my outside world. The very next day, I actually had a Zoom meeting. So, I had the computer screen in front of me. I sat back and I was just face on face. And one meeting was with somebody that knew me before and somebody was new, and neither of them said anything. And I felt like I needed to make an excuse for myself. And they're like, what? Oh, you shaved your head? Because I tightened up my hair, obviously, for the procedure. And then that was that next day. And then I actually had a presentation where I was going to be in front of people, hundreds of people, about a week and a half later.
Oh, wow. Let's take a look at his before after. So we're going to see his before and then 4.5 months after. So typically what happens is we place the graft, then the next week, the little tiny hair in it gets released, right? Falls out. And then the follicle will typically rest for about 4 months, and then it will start growing. And so you've got to grow from, a sprout all the way into a giant tree. And so when hairs start, they're oftentimes a little bit curly and a little skinny, kind of like a sprout coming out of the ground. And then as it grows into a tree, the trunk gets thicker and thicker. And so this is 4.5 months. I would say he's a little bit of an early grower. So that's a pretty good result for just starting out, right? And
his end result will be in a year. So there's more growing for sure.
So it really takes a year or more to get to your final result after a hair transplant.
How was your post-op, those immediate 10 days?
Sure.
Was it pretty easy?
Yeah, so I followed fairly religiously to what you said, because I told you that I had a major speaking presentation in front of hundreds of people within about at the 9-day mark. Yes. And you said, hey, that's a little aggressive and ambitious. However, if you follow the steps I'm giving you, I feel confident, you'll feel confident. And so I did that, which was, it's not labor intensive. It's just following the steps, shampooing your hair, like you said, doing the massage, doing the things you told me to do. Yes. I did those, and then I felt comfortable. And in 9 days, I was on stage in front of, almost 1,000 people, and in front of people for the following day. And nobody blinked an eye. Nobody asked me anything.
How about pain-wise?
So the most painful part of this whole ordeal was after Adriene took my picture and then showed me the top of my head, and I saw how bald I really was going. That was the most pain I endured. The emotional pain. Physically, again, it was fairly insignificant. I mean, at the moment, you numb me. I don't really know what's going on. It didn't matter. The whole 12 hours was nothing. I went home. There was no pain, no fallout afterwards. Yep. And there was nothing to deal with.
Yeah, most of our patients just take Tylenol and Motrin, and that's all they'll need. And there'll be some numb feeling, in the areas that we harvest from and graft to, and sometimes it feels a little sensitive. Or if you I bet you if you do this right now, you'll probably feel a little differently than it did before. You'll maybe notice that, but really it's not too bad to go through.
No pain at all. I've had other surgeries, and you have that numbing feeling for a while in certain areas. It's just different, but certainly not uncomfortable.
Good. Anything else you wanted to add? What did we forget to ask you?
When am I going to get a ponytail? Am I going to dreadlocks? Like, what's the time frame for the full deal?
You can come back tomorrow. We can talk about all the other things you wanted to do. I know it's a long list of stuff, and we'll see what we can do to get there. But thank you very much for coming in. We're going to go ahead and switch over to our Q&A, question and answer session. I know Brett's been in the chat room, and hopefully you got a couple good questions for us.
I'm going to start off with Renee. She chimed in first with us. She is asking a question about autoimmune disease. Question is, can that cause hair loss? And if so, how do you correct it?
I've had another physician send a patient here who had autoimmune frontal hair loss and for a hair transplant. And we sort of figured out that there was autoimmune problem going on, and that process was targeting the hair. And so that's not someone we would want to rush into a hair transplant procedure unless we were to do some sort of treatment and get resolution and maybe be assured it's not
right. And with our hair max, we tailor the hair max, especially the medication portion of it. We tailor it to whatever disease is going on. We tailor it.
Yeah.
And we can really, really bring it back.
So
bring the hair back.
The important thing is we need to figure out what kind of autoimmune problem it is. If it's one, that's readily treatable or not. And we sort of figure all those sort of things out on a case by case basis. But that's one of the important things about having that dermoscopy is identifying that like right out from the beginning.
A asks, just dating. This sounds too good to be true. I think she's excited. She says she's 31. Should she wait to do it? After my baby hairline never went back to the way it was.
So that is a good question. And that's one of the things we figure out when we do the consultation is sort of, we need to get a little bit of a bigger picture. We want to know about your family history on your mom and your dad's side. And we want to know about your medical history. And then we want to get a dermoscopy and sort of put this whole package together to figure out what's going on. And then is this a good time, to begin medical treatment? Or is this something where we need to go right into transplant and, or both?
Question from two people, David and Steve. They're both asking about traveling to Turkey. Is it safe? It seems more affordable. And is that extreme?
Not extreme. Been popular. There definitely have been some problems. 3 to 6 months ago, somewhere in there, we had a consult come in. Her friend went there for a breast augmentation and came back with an extra scar and missing a kidney. And this was a friend of hers, and so she knew her well. And yesterday or the day before, my nurse read a story about someone else who had other things taken out of them. And so, yes, people do it. Yes, it's popular. There's definitely some risk in going there. And then really a number of the things that I see coming back are maybe not of the kind of quality that we would hope to see.
Right. And then we emphasize that hair loss, even just doing the hair transplant, for us, it's really a journey. It's about following up with them. It's about, following through not just for the surgery itself, but their future hair loss. So I think that's very important for patients to know. It's, yes, you can do a hair transplant, probably a lot more affordable, but what about the rest of the journey?
It's also, if you needed medical treatment, which sort of we talked about needs to be carried out for a long period of time. And then if you get there and you have an autoimmune problem for your hair loss and then have a hair transplant, all of your hair would fall out, right? So you sort of want to make sure that you're doing the right thing and that the hair transplant's the right thing for you. And so if you were to go across the world and then it's inappropriate, will they even know that it's inappropriate? I guess is a big question.
Yeah, I remember that story from our patient who had a friend who went there. What a scary, scary thing.
Yeah, just like, yeah, awful.
Yeah, please come here. Definitely. Wanda asks, I've had a previous hair transplant, but I'm not happy with it. Can you fix it?
Odds are we can make improvements on that. And the common types of things would be sort of unnatural hairline. Maybe one of them work of coming from a female. It's likely it's an unnatural hairline.
Gotcha. Or density.
Or a density problem. And so we can take someone who has maybe too straight of a line and make it a little more rough or increase density so that you can't tell it was transplanted.
And again, with our dermoscopy, we can really have an idea how much can we improve, but how much hair can we actually give them.
And you can look at the pictures with us. When we're looking at this density, we can show you the spaces where we can, put the grafts in or where you're missing grafts. You can sort of see it for yourself.
Kevin wants to know, does castor oil help with hair loss?
That's definitely one for you.
There's a myth that they say it could help. Should I give my personal opinion? Like I feel that patients should. It's not going to hurt. Let's put it that way. I don't think it'll hurt anything. But if hair loss is present, I think we should treat it more with medical than.
So I would say
not
that
use it as an only resource. That makes sense.
Yeah. We got a lot better than that. How about that? We got a lot better than using castor oil. So, probably a lot better. So it
won't harm anything.
We could do, exactly.
I like that. I think that's an old wives' tale. My grandma swore by it, but it didn't really do anything, as I recall. Tyson wants to know, will I be able to swim or take part in my favorite sports with my new hair?
Once it's healed, you can play tackle football. You can wear a motorcycle helmet. You can, in fact, we have professional football players that will do it in the off season and go right back to camp. But you can do whatever you want. You can perm it. You can color it. You can wash it. You can get in the pool. You can have it in the wind. It's totally natural, your hair. And all we did was take it from one place and move it, relocate it to another place, and it's completely natural hair.
Let's go with Rodney. If I'm not from the Danville area, can you give me a consultation or a quote without a visit to the office?
The answer is yes. We have many patients who are out of state or live far away. Typically what we do, we will not. So we do the consultation, we give the pricing, and if the patient decides to move forward, whether it is the morning of surgery or usually during your pre-op that we do 2 weeks prior, we do see the patient at that point and do our dermoscopy and just verify that everything is what we intend, and we move forward. So definitely the virtual consultations, we always combine it with seeing them at some point.
So virtual consultations work just fine in hair, especially, and we can do most of what we need to do and give you a very good idea of, especially if you haven't had a procedure before, you had just an FUE before, we can give you a very good idea of what it's likely to be. But then we'll want to confirm that with you in person and make sure we get the camera on your head to make sure we're not missing something. But for sure we can do long distance.
I think we have time for a couple more. Bill says, if I have a transplant and want to add more in the future, can I do that?
Absolutely. It's very common. Not everybody will do more than one procedure, but it is pretty common that someone will do more than one procedure. If you just have a little frontal loss, maybe one and you're done. If you've really lost really across the whole top of your head, we might concentrate on the front and middle the first time, and then the second time do a little of the front, a little in the middle, and then the rest in the sort of crown. And so depending on what your needs are, we can do another procedure and add some more density or coverage, or both.
Jay asks, will my transplanted hair eventually fall out?
The quick answer is no. The hair that we take back here doesn't have the hormone receptor. And so when we move it up here, it's not attacked by the body like the hair on the top of the head, or the hair you lost would have been. And so that hair is permanent. It stays forever.
That hair we can really transplant to wherever. Facial, eyebrow, mustache.
Another good point.
Yeah,
yep.
we do that as well.
We do a fair number of eyebrow hair transplants. And so we probably have 1 or 2 patients a week who have tattooing in their eyebrows gone wrong, and will come in and get ask us for the laser, the tattoo removal laser. So we have a special laser that's really good at that, and typically only takes a couple treatments. But like none of them know you could get your eyebrows transplanted. Like hardly anyone knows that, right? And so we will let them know, instead of tattooing that, we can just take a little hair and move it there, and you'll have totally natural, natural hair for your brows, and we can make it sort of whatever shape and pattern and density. You will have to groom it because it will grow long. But
first year and a half, and then
yeah,
it kind of recognizes that it's in a different place.
But if you're the type of person who's going to tattoo your eyebrows or get an eyebrow transplant, you're going to be grooming it anyways. And so it's not that big of a deal.
They always look good. I have a question from Ashley. My husband's beard is spotty. Will this work on that area as well?
Absolutely.
Yep.
Go for it.
As we were saying, it's the same process, really. And we could do either the hybrid or the FUE. And it's really the same process. And we design according to what the patient wants. The beard or the mustache, or even in certain spots, typically we like to create it, like not go just for the spot, but kind of extend it too. So we cover and we even out the whole area. And it's the same process. It's pretty much the same recovery, maybe a little bit more swelling because we're on the face. But other than that, it's really the same process.
A little bit farther apart the grafts.
Yeah.
A little lesser density on a beard than say on the top of the head.
Correct.
Let's see. Do you offer payment plans?
I'm going to say that the best person to answer that would be Brett. Yeah.
We have a great finance company called PatientFi. You can certainly check it out on our website and apply there. They do offer 12 months, no interest. There's some other great payment plans. I can chat with you about that offline if you call me at the office. And this is our last question that we have time for. When can I expect to see new hair growth from the grafts? That's from Alvin.
Good question, Alvin. Usually it's 4 months. So we put the graft in. The next week, the little tiny piece of hair will most likely fall out. Occasional. Sometimes they grow. Usually a few percent or 5% maybe will grow. Some patients will see a lot higher percent grow right away.
Scott.
Yeah, like Scott. But most of the time the grafts fall out. Rest around 4 months or sort of a bell curve. And 4 months is sort of the average when most of them take off, some a little sooner, some a little later. But that bell curve can shift to the left and to the right. And so some people might be 3.5 or 3 months, and some people might be more 5 or 6 months.
Right. And the reason why we say the year is because at 6 months, the hairs that fell out sooner will grow in sooner, and the hairs that fell out later will grow in later. They don't just awful young. So that's why we typically say 1 year is the end result.
Yeah. And so, yeah.
For those of you who are looking to book an appointment, there's a QR code here. Go ahead and scan that. You can visit our website, blackhawkplasticsurgery.com. We have online scheduling, or you can call me at the office. Myself or Adrienne can help you schedule a hair consultation. Back to you, Dr. Ronan.
Great. Well, that is all for our show tonight. I want to thank Adrienne for coming on. It's been fun working with her. I do owe her an apology because my 49ers last year broke her Eagles. She grew up in Philadelphia. And we played them, and it was pretty bad, and it just sort of
Forgive you.
broke the team, after that.
It's okay. No, I forgive.
I really feel awful about that.
It's okay.
I want to
Still
thank
have this year.
I want to thank Brett for being here and co-hosting, and
Thank you.
our special guest Scott for having the courage to come up here and face us and talk about one of his many insecurities that he has. But I thank you guys all for coming, and we love doing these shows, and afterwards there's always a sort of flurry of activity over the next weeks about whatever topic, and so we're happy to see you and go over all these things and discuss your hair with you, or really any other procedure. So thank you so much for coming, and we'll see you next time.